62 years old patient on warfarin. He is complaining and presented to the office with broken lower anterior bridge and badly decayed lower premolars, and he's interested in having them extracted and having implants. Vitals is blood pressure is 145 over 95, pulse 72, respiration is 19. His medical history is our plan of action: medical consult with the patient physician, extraction, implant, and we'll discuss the medications of patient and their effect on the dental treatment. Warfarin. The US brand name is Chromadine. The pharmacologic category: anticoagulant. They use prophylaxis and treatment of venous thrombosis, pulmonary embolism, atrial fibrillation with risk of embolism, and as an adjunct in the prophylaxis of systemic embolism after mitral infarction. Unlabeled investigational use for prevention of recurrent transit ischemic attacks and to reduce risk of recurrent infarction. Local anesthetic and vasoconstrictor precaution. No information available to require special precautions other than to stop at least 3 days before any surgical procedure. Effects on dental treatment. Signs of warfarin overdose may first appear as bleeding from gingival tissue. Consultation with prescribing physician is advisable prior to surgery to determine temporary dose reduction or withdrawal of medication. What about loprisol, metoprolol? It is a category of beta blocker, selective, used for the treatment of hypertension and angina pectoris, prevention of mitral infarction. The precaution for local anesthesia, vasoconstrictor, no information requires special precautions. There is no special precautions. Effect on dental treatment. Local anesthesia can be safely used in patients medicated with metoprolol. Non-selective beta blockers enhance the pressor response to epinephrine, resulting in hypertension and bradycardia. This has not been reported for metoprolol. Lisinopril, under category of HACE inhibitor, treatment of hypertension either alone or in combination with other antihypertensive agents. There is no precaution with anesthesia. Effects on dental treatment: dizziness, upper respiratory infection, hypotension, headache, chest pain, cough, nausea, vomiting, fatigue, and weakness. We should contact the physician to get a medical clearance because of the warfarin the patient is taking, and depends on the physician report we can either continue the treatment or not. The physician is Dr. Jones. Dear Dr. Jones, regarding Mr. Poncello, I've seen Mr. Poncello in my office today. He is a 62 years old and a patient of yours. He came for extraction and implants. Past medical history: hypertension, stroke, and irregular heartbeat. Current medications: Loprisol, Warfarin, and lisinopril. Our dental treatment: extraction of remaining loser teeth and placement of implant under GA. Please verify medical history, current meds and patient condition. INR: any precautions related to general anesthesia. Please inform us of any other issues of which we may be unaware. Thank you for your prompt response and cooperation for the safe treatment of our mutual patient. Sincerely, Akram Samuel, DDS. Thank you.